because that will make a massive difference in terms of sickling and crises. Nneka.
The most important thing to remember is the type of sickle that your child has, because someone with SS will respond very differently to someone with SC. But the information we give is very generalised. So I've got SC. I didn't get diagnosed till I was 25. I did swimming in the sea, everything, never a problem. So it's about, and that's what I mean about knowing your child and what they've got, how they respond to things is really key.
Hi, I was just going to actually say what Andrea said about wanting to facilitate your kids living the most full life that they can. I had a special consideration about school, because obviously children will do swimming lessons at school, so it's about having the conversations with the teachers, with the people that are going to be around your child when they go for their swimming lesson, making sure they're fully informed that as soon as your child's feeling cold, they need to get out of the pool and be wrapped up and dry off really quickly. We sometimes say they should be the last in the pool and the first out, and help to get changed and dry. But yeah, encouraging them to engage in everything is our aim, really.
Good morning, everyone. I've got a series of questions, but I'll make it short and swift. My first question is regarding the spleen remover. I've got a boy. I've got 3 kids with sickle. They usually have this spleen enlargement whenever they have their crisis. So the last time I spoke with Dr. Nazma, she was advising it could be taken out, removed. But while what I read on Google is saying the spleen is like an organ that helps infection. What it says was the spleen helps in reducing the rate at which they get infected. So when the spleen is being removed, how did they survive without the spleen? She said, she tried explaining to me, but I think there could be some kind of much more enlightenment regarding that issue. That's my first question. My second question is the Oromorph they give at the hospital. Is there any way where we can get Oromorph when there are some times when my kids have this pain, it's beyond the ibuprofen and Capo. It doesn't do anything. It doesn't do any magic on them anymore. So, but immediately we get into the hospital and they're giving some doses of Oromorph. It works like magic. The last time I spoke to the nurse in charge at Croydon, she said it's something they can only use in the hospital because they want to regulate the rate at which those drugs are being abused. I understand those things are meant to be regulated, but at a point in time, I myself as the mother, I get exhausted. The pain of having 2 kids experiencing crisis at the same time, or 3 of them at the same time as well, it makes me go crazy, I have to be honest with you. So I don't know if there's anything we could do about the Oromorph, or is it just you have to get to the hospital before you can have that? So, thank you.
Again, it's difficult to hear how distressing and difficult it is living with this condition. I'm going to ask Janine to come in on this. So the first question about Oromorph and pain, severe pain management, and then the second question about splenectomy and risks, benefits. If you're happy to talk to that, I'm happy to come on to it after.
So it's really hard to hear about your experience of wanting to be able to obviously do what you can for your child without needing to come to the hospital. I think it is generally policy that if a child, it might be different for adults, but if a child's in so much pain that they're needing a strong opiate such as Oromorph, that they do need to be at the hospital so they can be monitored. But I would encourage you to speak to your team about prevention. If there's anything more that can be done to try and prevent the painful crises. So that will be about, I obviously don't know your children, about whether they would benefit from hydroxycarbamide, a medication that we know definitely reduces the frequency of painful crises. So if they're not on that and they're eligible to be on that, I would really encourage you to have a chat with your team about it. And also chatting to your team about trying to identify the triggers for your children, again with a way to try and prevent them from getting the painful crisis in the first place. But you know, you're not alone. Other parents have asked about having oromorph at home, and sadly that's not a pathway for children at the moment, certainly for our cohort as well. But I would advise chatting to your team about disease-modifying treatment and just trying to work out what your triggers are for your children for the pain. With regards to splenectomy, there's a few things to say. So if you've been advised for your child to have a splenectomy based on something called sequestration, where your child's blood level can drop quite quickly, which can be dangerous, then the guideline is if your child's had two or more episodes of that, then splenectomy is considered to be a helpful procedure to just help prevent any future occurrences of sequestration. What we know in people with sickle cell is that over time the spleen essentially stops working effectively anyway. So the splenectomy is considered beneficial, especially with the view that the spleen over time will stop working anyway. You're right that the spleen is an important organ for fighting off infection, in particular bacterial infection. And that's the reason why children and young people with sickle cell from the age of 3 months are advised to be on regular penicillin prophylaxis to prevent those infections, but also to have the regular pneumovax vaccine. So I think if splenectomy is being recommended for your child, it's likely to be from the view of keeping them safe and helping prevent future significant sequestration, which can be dangerous.
Thank you. Thanks, Janine. Next question.
Yep, question, yeah.
Is it possible for to recover after 7 months when you've had your bone marrow transplant? And if you have any complications, how much would they delay it by?
So was the question, is everybody sort of back to normal within 7 months after a transplant? Is that right? Yeah. As always, all my answers, it depends. And so, because it's an intensive procedure, and normally a minimum time to recover is over short months, and that's if everything is very straightforward. But that isn't sort of just a yes or no thing. People are normally recovering and getting back towards normal all the time along that route, and it tends to be the first sort of 4 to 6 weeks that's particularly intensive. But depending on the type of transplant you have, whether that's a donor bone marrow transplant or using your own cells, so for gene editing, you might need different medicines afterwards. So with a donor bone marrow transplant, you need to be on immunosuppressant drugs, and that can be something that someone needs to be on for many months after the transplant. And over time, as long as there aren't any complications, we try and gradually wean people off those immunosuppressant drugs, and then the bone marrow and the immune system is getting stronger all the time. If there are complications like things like GVHD or graft versus host disease, when the new immune system starts misbehaving, then sometimes you need to keep those immunosuppressant drugs going for longer, and sometimes a lot longer. But in an ideal world, we'd want someone's really intensive period to be around 4 to 6 weeks of recovering of the sort of very early problems that the transplant procedure can cause. But then we're dealing with looking out for infections for around 3 to 4 months, at which point we're hopefully coming off the immunosuppressive drugs, possibly more from 6 months. And then as the immune system gets stronger and stronger, then we have to worry less about the potential of things like infections and other problems like that. So I normally say to people that around 6 months, that time's going to be taking, but probably 12 months is something more that you need to think about, that you might not be in completely normal circulation of being able to go to school and maybe going to work or college, depending on how old you are. But it is a gradual process, and as we see that things are going okay, we can gradually reduce down what we're worried about and what we need to keep an eye on. So it does depend a little bit on everyone's progress, but those are sort of rough timelines, I think, of once we're getting to 3 to 6 months, hopefully we're starting to get rid of some of what can be quite a few medications, and particularly that immunosuppressant drug. But at each time point we'll check to make sure that we are happy everything's going to plan,